Johnny is a little nervous as he and his mother make their way to an appointment with a clinical psychologist. At 6 years and 3 months, his pediatrician referred him because of learning problems and difficulty in speaking comprehensibly. Johnny cannot be tested by the usual techniques, such as Stanford-Binet scale, because of shyness and verbal limitation. To measure his IQ, he will be tested by techniques developed for children who have loss of hearing, speech problems such as aphasia, or come from foreign culture where different language and customs inhibit communication. By combining the Gasel developmental scale in early life before speech or good communication is possible, with the specialized tests, a nonverbal child's potential can now be assessed. Tests including the lighter International Performance Scale, the Peabody Picture Vocabulary Test, and subtests of the Merrill Palmer Scale, such as Seguin Form Board, the Mare and Foal Picture Completion Test, and the Mannequin, have been perfected for total or partial nonverbal testing. For example, the examination of this 6-week-old infant requires the Gasel developmental scale. The Cattell scale and the Griffith scale also are used frequently. Dr. Arnold Gasel of Yale University, who established landmarks in development for all normal children, found that a child should roll over at 3 to 5 months, sit at 5 to 8 months, stand at 10 months, walk and have a beginning in speech at 12 months. There are many other Gasel indices used in examining children, including reflexes, head control, ability to bear weight, and others shown in this sequence. This infant shows some weakness and bears weight poorly. She is approximately normal for her chronological age of 6 weeks. At 10 months, another child suffering from galactosemia sits up with some support and stands with minimal help. His head control is good, but he does not have good writing reflex, the protection of the head by extending arms. He should be responsive as he watches himself in the mirror. At normal development, he should pick up the blocks, transfer from one hand to the other, and hold them securely. Later on, he should put them in the cup. We note whether he uses a palmer or a neat pincer grasp. As different items are presented, note activation of both arms. We expect him to pick up the pellet, but he is interested mostly in the bottle. However, this child appears to be close to his normal level of 10 months. This baby, between 9 and 10 months old, performs close to her age expectancy. Note how she picks up the various items, appears interested, transfers from hand to hand, and handles items with a good grasp. Picking up the pellet in a neat pincer grasp is a typical 9 to 10 months item. If the pellet were picked up and placed in the bottle, development would be at 15 months level. She is able to stand, expected at 10 months. At 17 months, this girl is small for her age due to hypoglycemia, which requires continuing dietary control and hormone therapy. She is lethargic and aimless in her actions. Note how immaturely she handles the various items as compared with the preceding 10-month-old child. She should be able to pick up the pellet and place it in the bottle. She is fairly alert before the mirror. Note a typical Palmer grasp. She still mouths everything. Her motor development is weak. She can scarcely bear weight and is unable to stand alone. This child is below normal in both developmental and motor functions. Her developmental quotient is 71. 8 months later, the same child has a good pincer grasp of the blocks and seems more alert. At 25 months, her quality of performance has improved. She handles the various items with more assurance and purpose. Note how she picks up the pellet and puts it in the bottle. She is more mature and no longer mouths everything. She puts the circle in the board, a 15 months item. The crayon is held in a crude Palmer grasp, and she is unable to reproduce the horizontal line. This girl is making progress, and her DQ is now 78. This 3-year-old boy makes a good tower of blocks and has no trouble making a train of them, a 2.5 to 3 year item. The pellet and bottle are easily managed. The form board is a 2-year item, and the reverse is 2.5 year level. The boy adapts well. In the Gasel card word identification test, his progress is satisfactory, and he goes on with the crayon circle test, which is a 2 to 2.5 year item. The total examination of this boy placed him only slightly below his chronological age of 3 years. PKU, or phenylketonuria, has caused moderate retardation of this 3.5-year-old boy. At 2 years, his DQ was only 48, but after 1.5 years of strict dietary control, his DQ now has improved to 68. He is unable to handle the various items well and is unresponsive. He does better with the pellet in the bottle and manages the form board in regular and reverse positions. The form board and the reverse at 2 and 2.5 year levels are attempted. He does not succeed with these or the horizontal line. His span of attention, which is short, is running out. Although this boy shows benefit of the team approach in clinical treatment, he is still below his chronological age. This multiply handicapped girl has difficulty in coordination and locomotion and has a profound loss of hearing. She is 4.5 years old. a cerebral palsy child who has no speech. Using the lighter items at 3-year level, she completes the half-picture test. She matches form at 4-year level and continues with form, color, and number. At 4.5-year level, she must match concepts such as male and female figures, horse and cow, etc. She completes matching the 2-color circle test at 4.5 to 5-year level. This child is making good progress and is approaching her normal development. Note the hearing aid that helps her follow verbal instruction to some degree. Using the Seguin form board, a timed test of the Merrill Palmer scale, this Hawaiian girl of 5 years is able to understand and perform well. She is unable to utter any meaningful word and has some loss of hearing, although not entirely deaf. Another timed test, the Mare and Foal picture completion test, is also completed satisfactorily. Her behavior and frustration levels are adjusted and in good order. Here she reconstructs the mannequin figure, a 5-year, 9-month item, very well. It appears that this girl is not retarded, but requires training and aids to improve her hearing and speaking ability. With the Seguin form board, this 5.5-year-old girl does well in a timed test. She has no speech. In this test, she has a neat pincer grasp. The errors or unsuccessful attempts are noted. With the Peabody picture vocabulary test included to confirm findings of the Seguin form board, the child identifies promptly, pointing to the one of 4 figures on a page the examiner names. Again, failures are noted. If 6 failures out of 8 attempts occur, the test is discontinued. She draws the circle and cross, but has difficulty with the square. She is slightly below normal. This 5.5-year-old girl has been severely damaged by PKU, phenylketonuria, and has no speech. She exhibits signs of autism, such as rocking motion, arm waving, eye covering, and is unable to handle the Gasel items at 2 to 3-year level. Unlike the PKU boy of 3.5 years presented earlier, this girl did not have benefit of early diagnosis. Although she manages the form board 15 months item in a mechanical way, she has trouble with the reverse, an 18 months item. Thereafter, her performance is generally unsatisfactory due to the brain damage caused by PKU. She is severely retarded, and her test result is far below her chronological age. This Hawaiian boy has no speech, although it has been medically ascertained that his hearing is normal. Using the 4-year lighter test, with geometric forms and various colors to be matched, he does all right. He is alert and watches the examiner for voice clues. He does well with the 4 3/4-year test, requiring matching of form, color, and number. The next 2 tests are at 5 and 5.5-year levels, based on matching concepts requiring reasoning ability. When presented with 6-year test, he could not succeed, and the session was discontinued. He is normal in intelligence. This girl of 6 years and 3 months doing the Seguin test is multiply handicapped physically. She manages the Seguin board very well. She has coronal synostosis, a cleft palate, and a syndactyly of both hands. The right hand has been surgically corrected, and the left hand is next. She has no speech or means of communication. She is slow, but handles the mare and foal timed test satisfactorily, a 5.5-year item. Notice her interest in what she does. Continuing at the same level, she succeeds with the mannequin test. Note how she holds the pencil as she reproduces the circle and the cross. Beginning with the lighter items at 2- and 3-year level, she matches form and color, and then the star, cross, circle, and square. At 3.5-year level, she completes the half-figure soldier, policeman, etc. set. Moving up to 4- and 5-year levels, she continues to perform well as the tests become more complex. This girl is only slightly retarded and is making a good adjustment in spite of her many physical handicaps. She is now in a public school class for educable mentally retarded children. Without surgery and other treatment, she would have been institutionalized. Her IQ is now at 74. And now Johnny is exchanging information with the psychological examiner to the best of his ability. Based on the preliminary discussion with Johnny's mother and this brief preparation, the examiner begins with a Peabody picture vocabulary test at 5-year level. Results are satisfactory. When the 6-year level is reached, Johnny makes 6 errors out of 8 attempts, and the examination is discontinued. He has reached his ceiling almost precisely at his chronological age of 6 years and 3 months, which rates him as normal. Tutoring for the school problem and speech therapy have been recommended. Johnny leaves the hospital in a happy frame of mind. His speech and hearing difficulties are not due to lack of mental ability. The sequences you have just seen are but a part of the total examination each child receives to determine his potential. The various techniques selected for demonstration show how children can be tested for development and mental ability when they are too young to communicate or unable to communicate due to speech and hearing problems. When parents notice that a child is not developing at the rate expected, the family doctor should be consulted and arrangements made for psychological testing. With the many techniques developed for nonverbal testing shown in this film, every parent can now be sure that existing skills and facilities are available to measure the potential of any child through 18 years of age.